Welcome to the deep dive. Today, we're diving into something that, well, it might start really small, like a bump or a scrape you barely notice, but then it turns into something, genuinely worrying, a wound on your leg that just, it won't heal. We're digging into this because actually one of you shared a story that really brought this home. They mentioned their mom, had this small knock against a dishwasher door, just a graze. You'd think nothing of it. But fast forward 3 weeks and it's become this large open wound leaking quite a bit of fluid, the leg's swollen too, and crucially, it just isn't getting better. So our mission, using the source material you gave us, is really to figure out what's going on. How does a little bump become, well, this kind of persistent problem? What's actually happening under the skin, according to the science? And, knowing all that, what's the smart thing for someone to do? Let's just revisit that scenario. It's a minor injury, right? A graze. But instead of healing, it gets worse. Big, weepy wound, swollen leg, weeks passing. That feeling, that gut instinct that something's wrong, it's absolutely spot on.
I mean, a normal wound, it should be looking better way before 3 weeks.
Absolutely. And that situation you've described, it's exactly the kind of red flag the sources are talking about. It points very strongly towards something called a venous leg ulcer. And these are, well, unfortunately, they're pretty common. They're a type of chronic wound, which just means they don't heal in that sort of normal time frame.
A venous leg ulcer.
Yeah.
Just from knocking a dishwasher. That feels really surprising. Makes you think, okay, hang on, how does that actually happen?
Yeah.
It seems like the injury itself, shouldn't be enough to cause something so major.
And you've really hit the nail on the head there. That's a core insight from the sources. It's usually not the injury itself that's the main issue. The little knock, the scrape, often that's just the trigger. It reveals, or maybe makes worse, an underlying problem that was kind of lurking there already. So what's typically going on under the surface is poor circulation in the legs. Specifically, it's a problem with the veins getting blood back up to the heart. You can sort of think of it like plumbing. If the little valves inside your leg veins aren't working properly, blood can pool up, pressure starts to build. And this pressure, well, it forces fluid out of those veins into the tissue around them in your leg. Now, all that extra fluid and pressure, it really damages the skin from the inside out. It creates a, frankly, terrible environment for healing. So for someone who already has this venous insufficiency, even a tiny bump breaks the skin. Skin that's already swollen and compromised. Like the source material says, you've basically got the perfect storm for a venous ulcer. The injury just opens the door, but the vein problem underneath stops it from closing again.
Okay, right. So the injury isn't the root cause. It's more like a spark, isn't it? Igniting a fire because, well, conditions were already set by this poor circulation issue. That's a really key distinction. A bit of an aha moment, actually, for understanding it. So, okay, for anyone listening who's maybe experiencing this, a wound not healing, it looks weepy, legs swollen after just a minor thing, what does the source material say? Is it the absolute first step? What should they do?
The message, the most critical one from the sources, it's really loud and clear. Do not wait. If you have a wound on your leg and it hasn't started to look better, show some improvement within about 2 weeks, you really need to get medical attention. See a nurse, see your GP, don't just leave it. And the sources definitely highlight those specific warning signs you mentioned. If the wound is leaking fluid, we call that exudate in medical terms, or if it seems to be getting bigger, or even if the skin just around the wound looks redder or more swollen. These are all strong signs that it's more than just a simple scrape. And waiting. It just makes the whole thing harder to treat later on. The longer it's left, the more complex it tends to become.
Got it. So act fast. Early help is crucial.
Yeah.
Okay, so once someone does go see a professional, what happens then? What kind of assessment are they likely to get? What are the nurses or doctors actually looking for?
Well, they'll do a pretty thorough assessment, looking at the leg generally, and of course the wound itself. They'll check the wound's size, how deep it might be, how much of that fluid, the exudate, is coming out, what it looks like, and really importantly, they'll check for any signs of infection. Things like increased redness, warmth around the area, maybe a smell, and crucially, they absolutely need to check the circulation in the legs. The main way they do this, as the sources describe, is with a test called the Ankle Brachial Pressure Index, the ABPI. It sounds complicated, but it's actually quite a simple test. It just compares the blood pressure reading in your ankle with the one in your arm, and that comparison. It gives them really vital information about the blood flow down into your lower leg and foot. It helps confirm if that venous insufficiency is likely the problem, and also tells them if certain treatments like compression are actually safe to use.
Okay, so they're not just looking at the whole, they're checking the whole system running underneath it. Makes sense. And if they do confirm, yes, this looks like a venous ulcer, it's caused by poor circulation, What's the main treatment strategy then, based on what the sources say?
The absolute cornerstone of treatment, the thing with the most evidence behind it that the sources highlight again and again, is compression therapy.
Compression therapy. That sounds, I don't know, maybe a bit intense.
Yeah.
Complicated.
Yeah, it might sound like that, but actually the sources describe it as a pretty practical approach. It usually involves applying specially designed compression bandages, or sometimes stockings, to the leg. And their job is quite straightforward, but incredibly effective. They basically give external support to those veins. They help squeeze the blood back up towards the heart, countering that pooling and pressure buildup we were talking about earlier. It's highlighted so many times in the sources as being really, really good at reducing the swelling. And that allows the ulcer to heal because you're improving the blood flow away from the wound area.
Right. So the compression tackles the underlying cause, a sort of plumbing issue. But what about the wound itself? Especially, dealing with all that fluid. How do they manage that part?
Yeah, good question. That's where strategic wound dressings come into play. It's not just any old plaster. The choice of dressing really depends heavily on how much fluid that exudate the wound is producing. So if there's a lot of fluid, they might use something like a highly absorbent foam dressing. If they suspect an infection, they'll likely use dressings that have antimicrobial properties. And there are also, more advanced dressings available now that are designed specifically to create that perfect, moist environment needed for new cells to grow and the wound to heal properly. The goal with the dressing isn't just to cover it up. It's really about managing the moisture. You want it moist, but definitely not soggy, and protecting the new tissue that's trying to form, plus shielding the skin around the wound from getting damaged by all that fluid.
Okay, so it's quite tactical then. Compression for the cause, specific dressings for the wound itself. What else did the sources mention as being important for healing? Any other pieces to the puzzle?
Yeah, definitely. Consistent professional care is key. That often means regular clinic visits for dressing changes and checks. But the sources also really emphasize the patient's role. Education is huge here. Simple things like elevating the leg whenever you can, getting it up higher than your heart. Ideally, that makes a massive difference to swelling. Gentle exercise too, like just walking, uses your calf muscles to help pump blood back up. Good nutrition is always important for healing any tissue. And taking good care of the skin around the wound, keeping it moisturized and protected, prevents it from breaking down further. And here's something really interesting, especially thinking back to that listener's story. The sources really stress that just healing the current ulcer, that's only half the job. Preventing it from coming back again, preventing recurrence, is seen as just as vital. Maybe even more so in the long run.
That makes total sense. Because if the underlying vein problem isn't managed ongoing, then, another little bump could easily just start the whole cycle over again, couldn't it? So if we try and bring this all together, connect it back to the bigger picture for our listener and anyone else maybe worried about this, what's the essential takeaway message from all this source material?
I think the core message is pretty straightforward. A leg wound that isn't healing within, say, a couple of weeks, especially if it's weepy, getting bigger, or if your leg is swollen, that's a signal. It's a signal your body is sending, and you absolutely shouldn't ignore it. It's often, very often, a sign of that underlying poor circulation we've talked about, the venous insufficiency. So the advice is, seek professional medical help and do it early. Don't delay. With a proper assessment, including checking that circulation and getting the right treatment, which is primarily that compression therapy combined with the right wound care, these venous ulcers can heal. And really importantly, with ongoing care, maybe wearing compression long term, and making those lifestyle adjustments, the risk of them coming back can be significantly lowered. The key is, don't try and manage it alone. Get expert help.
That's incredibly clear. And really practical advice. It definitely hammers home the point that a wound sticking around isn't just, bad luck. It's often a symptom telling you something really important about your circulatory health, isn't it? So, to the listener whose story kind of sparked this whole deep dive, and really to anyone else who might have a similar worry about a wound or maybe just swelling in the leg, please, take this information on board. Take action. Don't just dismiss it as a stubborn scrape that will eventually go away. And maybe, just maybe, the final thought to leave you mulling over is this. Given how absolute central that underlying circulation issue is to the whole problem, and how important preventing recurrence is, could we perhaps be a bit more proactive about our leg health before a wound even gets a chance to start? Like, are we paying enough attention to maybe earlier, subtler signs? Things like persistent leg swelling or maybe aching legs, or even just changes in the skin color around our ankles. Could spotting those kinds of signals early be the ultimate prevention strategy here? Something to think about. Take care of your legs, everyone. Listen to what your body might be telling you. And we'll see you next time on the deep dive.